The data exchange came about because in 2011, Los Angeles Unified School District received bond money, and they took a portion of that and they actually allocated it to building physical buildings of medical clinics on school campuses in the highest need areas. And they said to the Los Angeles Trust for Children's Health, hey, can you help us make sure children's health programs are being implemented and that students are being seen? So we built a database that collects data at the click of a few buttons from all different EHRs, electronic health record systems, from all of our clinics. What made the data exchange as revolutionary as it is later on we were able to add academic data to the database.
The children we're serving here in LA are the most vulnerable. 90% of our kids are children of color, 80-some% live below the poverty line. There are just incredible risks in terms of public health. And the data exchange, we can see how the intersection of systems work. And I think that that's really important for us because we do want to use this tool for population health, for clinical care improvement, and for system monitoring and agility to look at impact in a way that we haven't before.
So what's really unique about the data exchange is that you can merge data on an individual student across all these different sectors. As a result, we now can see all of the different kinds of services that a student might receive, whether that's from a school-based health center or services they're receiving in their school, and then look at outcomes across both spheres. We know that education and health are intimately connected. We know that how healthy a student is affects their ability to come to school, ready to learn every day. But now, for the first time, we can actually show which types of services impact which types of outcomes for which students.
The Journal of Adolescent Health published findings based on data from Data Exchange, demonstrating that visiting a school-based health center significantly improves student attendance over time. The improvement was even more pronounced for students with a mental health diagnosis. These results suggest that SBHCs can enhance population health and promote health equity. The findings were derived from data collected by Data Exchange.
So when we set out to build this, we knew that our clinics don't have big IT departments, and it had to be simple and easy for them to use. So the system was meant to make it easy for clinics and school districts to give us their data, and it also makes it easy to scale, to bring in other partners who might want to share and blend their data with ours for research purposes.
The data exchange has an agreement between the school district or the clinical provider that is a data use business associates agreement. So with those kind of agreements, HIPAA and FERPA protected, no one has to opt in for this data. It's used for public health purposes, for population health, and system improvement.
As different sectors contribute data, we will be able to look across the whole. So whether that's a vision care provider, a dental provider, a primary care provider, an insurer or a payer, additional school districts will be able to track each individual both across these sectors and over time.
The partnership with the LA Trust and St. John's is really like this match made in heaven. It allows us to really hone in or take a deeper dive into how we can not only just assess and help provide care to our students, but also to our communities as well.
Clinic managers can review service delivery data to ensure that quality care is being provided. Clinicians can review protocols for students and the community to include STI, substance use, and depression screenings, or anything else the data shows is needed.
The way data is being used is to really, it allows us to get a bird's eye view as to what we can really tackle and really make data-informed decisions. When we get that information, we can literally either build a program around it. We can also build campaigns along with the LA Trust and the Student Advisory Board to really work to service the community and the students.
As a researcher, the thing that's really nice about this system is that it is completely de-identified data. I don't even have to go through all of the challenges of making sure that I de-identify the data before I get it. It's already de-identified, and there's no way to break the code.
Our approach with the data exchange was it can't sit on the shelf. And so this concept of creating report cards for students that gets generated every year. There's a report card for a principal that gets generated every year. There's a report card for school board members that we share with school board members so they can see what their district is actually earning and how their students might be better served by these types of systems. And they're understanding where there is parity or disparity in the way care is delivered. And the data helps them understand that.